The COVID-19 pandemic has made people wary of potential transmission routes, especially in shared, public spaces that require contact with high-touch surfaces. Despite restrictions on where the public can go, food retailers have remained essential, increasing worries about these spaces. But there isn't good information on the presence or survival of COVID on surfaces. Therefore, we embarked on a mission to assess the presence and potential risk of transmission from high-contact surfaces in a real-world setting. So, we performed a survey of high-touch surfaces within selected Ontario food retail stores between October and November of 2020. Stores in both urban and suburban areas were chosen. We collected samples at stores on high and low volume days, as well as before and after store hours to have a holistic view of the situation within a food retailer. The selected dates, times, and areas allowed for us to evaluate the potential public and employee contribution to service contamination. Additionally, the cases in surrounding areas were monitored to evaluate their effect on the presence of the virus on surfaces. We selected surfaces based on their accessibility to employees and customers of the establishments. In total, 15 samples were taken at each location, from the payment stations, deli counters, carts, and freezer sections at each time, resulting in 957 total samples. The data collection occurred in 2 stages. The first was sample collection at the store, and the second was testing for the presence of viral RNA in those samples. First, a small area was swabbed using a sterile swab with transport media. The samples were then stored under refrigeration and transported to the Purity IQ labs for processing and detection. Virus RNA detection was performed using a reverse transcriptase quantitative polymerase chain reaction technique. A Health Canada authorized testing device and kit were used. All internal and positive and negative controls were within testing range and were used for validation of the method. Regardless of store location, the sampling day and time, the location of the surface, or the surface material, all the samples tested negative for COVID-19. These results emphasize the importance of preventative measures to reduce the probability of encountering COVID-19 on surfaces commonly found and frequently touched in food retail stores. The risk of exposure from contaminated, high-touch surfaces within a food retailer is low if social distancing guidelines, use of PPE, systematic monitoring of the store personnel's health, and recommended cleaning protocols are followed.